If someone fell and bumped their head and had a concussion, how long would you wait to treat? Like, is it the normal, like, wait 24 hours? And then the other thing was if someone just gave birth, how long would you wait to treat as well?
Good questions. Well, if you had a concussion, you want to avoid two, three things. First, make sure there's no bleeding and that the bleeding stopped for sure. If there's a bleeding, there's not a, worst case scenario, an aneurysm that broke in the brain or anything like this, that would be obviously a contraindication. Sometimes the fracture of the skull don't appear immediately. So sometimes you have some hidden fracture of the cranium, or for example, typically it's called the fracture of the dance of C2 that's not seen immediately. So before you move that neck and think you don't see that. So you could do 24-hour if you are the medical team tell you there's no more bleeding and no more fracture, and you have to be very gentle anyway to not, maybe there's something ready to break up. So you don't want to lead the brain, but be led by the tissue and follow what you feel, and don't press more and don't invade the space, but just really follow the path of this resistance as much as possible so you don't damage anything. If you are 6 weeks after an accident, for example, you don't have to worry. After 6 weeks, usually everything is clear. If there's a hidden fracture, you'll know it. But 24 hours after, you want to be very, really gentle and really do indirect technique, path of least resistance, gentle, and make sure that you feel that the tissue wants to go there, not force it anywhere it doesn't want to go. So be led by the tissue and don't impose you touch on the tissue. So that's something that you want to watch for. Birth, that is not usually a problem because you can even work on the baby inside the womb of the mom if you want. You could almost touch the cranium, the spine, do different things there and connect with the baby. And as soon as he's born, you can work on the cranium because, the skull of a human baby are too large almost for the female pelvis now. You cannot go so much bigger with your brain. So already the bones has to overlap. So at birth, hopefully after the first breath, they begin to come back to normal. Sometimes they don't. So you want to make sure that the bone are all together flat so you can work immediately on the baby. First let the mom be connected with the baby emotionally, and then you can work as soon as you want, gently. Now, it's not because it's a baby that is very light touch. Most of the time it's really light and beautiful, but sometimes they had a little bit of lack of oxygen, or something like this, and lack of oxygen create very thick membranes. So when you are confident and you know what the tissue wants you to do, and you feel, oh, I need a little bit more, the tissue wants to go in that direction, and I need to have a little bit more pressure. When you have experience, again, you don't play with that, but sometimes you need a little bit more pressure than you think because the membrane are really tight. And when you begin to work with the central nervous system, the baby come in. There's something we call ignition. It's an older concept. Alaya use it in heart center therapy. You have an ignition at conception. When the sperm meet the eggs, you have an explosion of energy. And that's also released by zinc ions at conception. It's known when you have conception, you have a certain ignition. And you should have an ignition at birth. Take the deep first breath. You feel the lateral ventricle and expand and everything is electric, and usually you have a big explosion of consciousness. Sometimes it's slow, sometimes it's more gradual, but you should have an ignition. And sometimes baby are not ignited. And by readjusting and putting all that properly in place, you have consciousness that comes sometime at birth. It's really beautiful to see. The second ignition at birth sometimes didn't appear, and you have people that are a bit weak, low tone, they don't know how to say no, they don't have clear boundaries, and you need to reignite them because they never had their birth ignition. And using the brain, realigning the brain, and the spinal cord, and you see often the baby being present, begin to look at you, look at the mom. Wow, he's there. So you help them sometime come back in their body, after all the trauma they had and they were in a different space, and now you arrive in this space and sometimes it's so different. They were warm and calm and it's so aggressive. They don't really like what those people around, what's going on. Sometimes you help them really to receive them, welcome them, care for them, tell them they are loved, they are safe. And that's very important. So those touch really help them because the trauma that they had, if you release them, they can feel safe and present and something really, really important.